Welcome to MACadMED's Core Ultrasound course. My name is Osama Ahmed. I'm one of the emergency medicine consultants and I'm currently practicing in NHS UK. In this course, we are going to talk about the basic physics and knobology, the ultrasound governance, principles of ultrasound. Ultrasound nowadays, they are more easy to handle and there is no lots of knobs on these machines, so it's easy to work through. And we'll talk about few things that will help you operating those machines and getting the best images. So to do that, we'll be talking briefly about physics, and I promise you that I won't be talking about lots of equations on physics. So what is ultrasound? Ultrasound is simply the vibration of sounds with frequency that is above the threshold of what humans can hear. So if we imagine that the white line is having the all audio frequency in the world, there is only a range where the audible human, the human ear can perceive sounds, and it's between the 20 hertz, as you can see here, the 20 hertz and the 20k hertz. The majority of the diagnostics are between 1 and 20 megahertz, and obviously the definition, as I said, is of the ultrasound is all the frequencies which are above the 20k hertz. We'll move to some definitions. So the sound is the series of pressure waves propagating through a medium. And the cycle of the acoustic wave is composed of this complete positive and negative pressure changes. And you need to know also that the wavelength is the distance traveled during the cycle. The frequency is the number of cycles in a unit of time. So how it works in a nutshell, the ultrasound transmit, the machine itself transmit electrical wave through the wire into your probe. And on the top of the probe, this is where all the magic happens. There is the piezoelectrical crystals that convert these waves into sound waves, which will travel through the medium. And obviously, these piezoelectrical crystals will receive the echo, which will come from the medium, and we have obviously multiple options. They either kind of hit a medium that kind of reflect the whole sounds wave backward, or sometimes they go through a medium where they go through without any reflections, and in between, like they tend to vary. Each reflection will give us a dot on the photo, on the image, and through which we can have an image which is a mixture between black and white, as you can see. There are definitions that you need to know about. So anechoic is when the wave goes through the medium or the substance. Like for example, if there is fluids, there will be no reflections. That's why it will be interpreted on the image as this dark black. On the contrary, if the reflection is coming all back, when for example the wave hits something like the bone, it tends to reflect the whole waves back. It will give us the hyperechoic. And in between, so you have the isoechoic and the hyperechoic. It depends on the type of the medium. Now, you need to also to know that the frequency, which is the number of cycles per a unit of time, if you have if you are using a probe that's using the high frequency, this will give you a good resolution of the image, but it cannot penetrate deep on the tissues. So, for example, if you are aiming to look into a vein or an artery, then you will use the high frequency probe, which is for the shallower or superficial structures. And this is it's different from the curvilinear, which has the property of deep penetration with a less quality of resolution. Moving forward, now you can tell exactly which probe to use. Now, with the probes, we have different types of probes. We have the phased array, or sometimes it's called the echo probe. You have the linear one, and you have the curvilinear, and we also have the endocavity probe for the internal cavities, like the oral cavity or the vaginal cavity. And again, this is a slide that demonstrates the difference between the high frequency and the low frequency. Moving to the knobs or the buttons, there are buttons that you need to familiarize yourself with on your own device or machine where you on your place of work. To start with, the off-on button is obviously is the most important one. Believe me, sometimes you will struggle to find it if you're moving to or you start using a new device for the first time. Other devices, things like the depth, the brightness, they are there mainly to help you refining your images and to get the best image that you can. Other buttons that you need to familiarize yourself with is the freeze button and the measure button. The orientation and the planes, so it depends on how you are using the probe and the position. So there are obviously the cross section and the longitudinal sections, and I'm using the cucumber analogy here. For example, if you are now scanning for the aorta, you need to know the side where the indicator edge is on your probe. So if you look here on this photo, on this image, you have the indicator on this side, and it should be on the same side with the button or with the indicator on your image. The majority of the time it's on your left hand side, especially when you are viewing the abdomen. And it can be on the right hand side if you are using the echo to visualize the heart. The machines are, it's automatic on the machine, so the moment you switch the probe into the curvilinear, it will get you to into the indicator into the left hand side, unless you want to change it. And this is the longitudinal section of the aorta, as you can see. And it depends on where you put your probe. And this is an anatomical position of your probe. I hope that this is clear. I'm sure that when we start practicing during our practical sessions, things will be more clearer for you. Now I'll move to the emergency ultrasound governance. So what do we mean by ultrasound governance? It is a set of policies and procedures and best practices that will give assurance to our safety board or seniors or to ourselves that we know what we're doing and we are mitigating the risks that can take place while we are using these ultrasounds. And how can it be done? I'll give you an example. We have a 70-year-old male who's presenting with abdominal pain radiating to the back and to the left loin. An enthusiastic registrar took the ultrasound and had this image that shows the aorta, and he measured that echoic area, which is 2.5 centimeters, thinking that this is the diameter of the aorta. Now, obviously, as we are going to learn, he should have measured from outer to outer layer or wall to measure for the diameter of the aorta, which is 7.8, and it is significant. And whatever is outside that echoic area is the intramural thrombus. Because there is a system in place through this governance system, as we will learn in a minute, we were able to say that there is a problem, and because it was reviewed by a senior doctor. So we talked about the definition, we talked about the importance, and we're going to talk about the components and how can we structure this framework of ultrasound governance. So this will be going through 4 main domains: the training and the competency, the standardized protocols, the quality assurance and audit, and finally, how can we maintain these skills. Training will be through, first of all, the course that you are attending at the moment, and this is only the start. You need to go back to your department and start populating or filling your logbook, asking your seniors or people who are expert on that to show you the techniques and the tips, and they can judge if you are going on the right direction and you are learning. And at the end of your training period, you need to go through like a summative assessment to have the finishing school, which will give you a certificate that you can practice independently. We work through guidelines, and obviously you need to have these kind of documentations and the other aspects and components of this training as we will learn later on. There are some principles that we need to know before moving forward about the ultrasound in emergency medicine. First of all, we know that it's a rapid, safe, reliable, it's operator dependent, it's useful, especially in handling some life-threatening conditions, and is also helpful for us in some procedures. And it's easy to learn, and this is the good news. But the principles are that we all need to know that we are not radiologists, and it is not a substitute for the formal ultrasound. You need to remember always that it's an adjunct to your clinical examination and history. Emergency ultrasound is about putting a focused binary clinical questions. It is a rule in, not a rule out thing. So the take-home message is you need to know your limitations, practice, 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 and adhere to rule-in philosophy. Thank you very much. See you in the course.